And it's so easy that you can do it at home. You can do it in a hotel room. This is another microbe. One last example about the microbe. There are many 500 varieties of microbe. Each one of them, if we take 1 minute, it will take about 500 minutes, which I want to cut short. But I want to give you a brief idea of what are microbes and how it contributes to your body. So I'm giving 2-3 examples. And one of the examples is viridans streptococci. A kind of microbe in 1990s was known to cause heart valve disease. Because it was found in 1990, all the patients, those who were suffering from heart valve disease, they have one thing in common. In their heart valve, they found this bacteria. So they could connect that if you have this bacteria in your mouth, from mouth it will slip to the heart somewhere, and that will cause heart valve disease. So what is the solution? Kill it. Finish it off. And it took about a decade's time to clear it, to kill it. And now what happens when they found that the people with very less this bacteria in the stomach, this means the resistant bacteria, it is in more quantity, and the resistant bacteria is famously known as GAS, G-A-S, group A strep, right, the short form. This less in your mouth, this is more in your mouth. This is more in your mouth, more you will suffer from immunity dysfunction, skin disease, autoimmune disease, right? All kind of illness. As you can see, the list is incomplete list, only the amount of numbers of disease which can fit in this slide, but there are many more illness which can cause if you try to kill this viridans, which we try to do through antiseptic mouthwash kind of things. So killing this is not going to be a solution. That is very clear, not only with us. For last, now it is more than 7-8 years, the modern medicine has understood that human being by now has almost become resistant to the medicine. This means the solution has to be beyond this. Beyond this. But the problem with the pharmaceutical company is they will try to find a solution which has to be profitable. So they found a solution. So today I'm going to share one solution which is, I think, profitable also. And if you like, you can practice it. Right? I'm going to train you for that. But I think it is beneficial also. Anything which is beneficial and profitable, should you practice or not? Yeah, right? Okay. There are a few people who are clapping, right? But let me. But it needs a lot of determination also to practice. It's easy to say I'll practice, but when it takes a little bit hard work, then let's see how many people clap. Okay. So you remember those who clapped? All your neighbors, just, and let me explain. And again, I will check whether they are still ready or not. Right? Okay. So I'm going to talk about the solution. Solution is one. You have to change the 1.4 kg bacteria totally. Now it is resistant bacteria. If you can replace that again with a friendly bacteria, problem is solved. Now the basic question comes is, how to do it? The science has an answer. Science has an answer, it could do it in few days. It is very easy, and a few days means 3-4 days. It's very cost effective, and it's so easy that you can do it at home, you can do it in a hotel room, or in this hospital. How many of you would like to try? Okay, very good, very good. After this, those who would like to try will go to the near that our naturopathy hospital and let's try, right? But let me explain that first. It is called, some of you are suspicious about, anyway, it is called FMT. The name is called FMT. It is New England Journal of Medicine, 2013, right? FMT to cure patient with recurrent, right, disease. Right? So technically, FMT is the name of that kind of therapy, and with this therapy you can cure most of the illness. Most of the illness. You can cure diabetes, you can cure hypertension, you can cure obesity. Now you know all these illness came from those microbes, and the microbe population you are going to replace, then everything will be cured. That too within few days. Sounds good? And that too cost effective. Okay, hold on. It is called FMT. The full form of FMT, facial microbiota transplant. This means you have to find a healthy donor, and here you have to take his feces. In Hindi, somebody asked me to translate in Hindi, mal. Stool, healthy donor. Healthy donor, the definition is he should seem to be beautiful and healthy, that's all. And then you will take the feces, the stool, put it in a pichkari, what you call in English, I do not know, right? And then this either goes through nose, or if you like, it goes through your esophagus. There are three ways it can go inside. You can choose your favorite way, right? Okay, step by step, let me explain, because now you have to do it yourself, right? First you have to find a donor and you have to do it. How many people are still ready? Only one. Still one is there. Two. Okay. Step one, you find the donor, healthy donor, beautiful donor, and you collect your, by the way, it is called, FDA has classified it as a drug, 2012, right? FDA has classified this as a drug. Since it is a drug, it can be sold in chemist shop. So then, according to your disease, they will which kind of feces is suitable to you, right? So that is what is being already tested. Tested now, maybe anytime it will be launched commercially, right? So, but you need not to wait till so long. I will explain it right now itself. So, you get the first step, the product. Then you have to screen the product. There should not be any unwanted virus, unwanted germs, and then you have to store it in a cold place. And now it can be implanted in your stomach through those three, any of the route of your choice or whatever is possible. It can be through enema, it can be through colonoscopy, it can be through esophagus, through nasal cavity, whatever is suitable or whatever you find is more favorite, you can do it, you can try it, right? So this is called fecal microbiota transplant, and it is known to change the disease system, right? Change to cure most of the disease within few days. Right? So this is very simple, right? Will you call it naturopathy or modern medicine? So they are correct that modern medicine can cure. So this is the modern medicine and it can cure, and this is the drug. It is classified as a drug. Now, you may be wondering how it will cure. First of all, it is very clear that this is nothing practical. Nobody will do. People will prefer to die rather than doing like this, right? So what is the other alternate, which is acceptable to us, people like us, right? So here I'm going to give you the true solution. If you don't want this, then I can give you a simpler idea, easier thing, right? So for that, only one slide. You have to understand, this is a place, about 20 years back, modern science told appendix is a part of the body which is useful or useless? Useless, worthless. Why? Because if you cut, even then the person do not suffer from any illness. After the cutting and throwing it out, the person is the same as before, without any change in any of the body or any of the body metabolism or any of the body homeostasis, no chemical change, no bodily change, no sickness status change. This means this organ do not contribute in anything. It is just useless. It is just carrying on with the humans for many, many generations, and no reason why the God has put this appendix, right? That is what is the understanding as a literature. Now it is understood that as your intestine get depleted of friendly bacteria, appendix, it keeps on collecting the sample of the friendly bacteria like a storehouse, right? Thank you. And if you give the right nutrition to your intestine, within 1,000 generation of microbe, the resistant bacteria can get converted into friendly bacteria, right? How many generation? 1,000 generation. Within 1,000 generation, the resistant bacteria will get converted into friendly bacteria, Because friendly bacteria reserve is already there in appendix, but they're in very, very small quantity. The only thing you have to do is, you have to eat or give those nutrition which the resistant bacteria do not eat. So what will happen? They will die. And as their population will reduce, total amount of population has to be constant. Then what will happen? From the appendix, the friendly bacteria will come and they will multiply, because they will go get a playground to multiply. Right? Very simple. How much time it should take? 1000 generation. So, in one day, how many generation? So, how many days? 3 to 4 days. As simple as 3 to 4 days. Whatever may be your past. Whatever may be your past, I don't care. I can tell you that within 3 to 4 days, your future will be totally different than whatever your past. Because you will be a different person, because you will be different second brain. Your second brain is totally different now within the first 4 days. So it is as simple or as complex as this. Now, the only thing you have to do is, for next few days, you have to ensure that you starve the resistant bacteria to death. Simple. You don't give any food to the resistant bacteria, they will die their own death. And other way around, you give the food to the bacteria, the friendly bacteria, the kind of food which the friendly bacteria like, and in that environment it will grow, and 1000 generation can pass within 4 days. Your microbiota is changed. The moment the microbiota changed, you are a new person. Blood pressure normal, blood sugar normal, cholesterol normal, pain gone. If you're fat, you start reducing the weight. Wherever is the fat, it will start vanishing. Within a month's time, 10% of the weight will be down. The tumor size will start shrinking. All those things start, you can notice within the first 4 days. Right? Okay, so now, the only rule is, for next few days, 3 days, 4 days at least, you have to starve all the resistant bacteria to death. This means at least for 4 days, you should not eat those things which your resistant bacteria may like. Right? So what are those things? This is the most important thing I would like you to understand very, very clearly. Only then you can do it. Food the friendly bacteria like, it is called prebiotics. Remember one thing. Friendly bacteria like one kind of food, mostly prebiotics. And this is the kind of food which resistant bacteria hate. They'll be killed. So it is solving two purposes. Friendly bacteria, they like it, it will grow. Resistant bacteria don't like it, they will be killed. So, did you hear probiotics? I said prebiotics. There is nothing called probiotics. It is prebiotics. Probiotics is a marketing term. That is probiotics, which, can you name any product with probiotics? Yakult. You see television ad too much. Right? So, Yakult, probiotics, right? Good ad. But good only in ad. Truly, probiotics, there is nothing called probiotics. I'll tell you what probiotics means. Probiotics means friendly bacteria, if you see the dictionary meaning. But, for example, in this product, it is given in a bottle, right? In a bottle, when it is packed, it becomes oxygen abundance or oxygen deficient. The friendly bacteria, how you will recognize friendly bacteria cannot live where there is no oxygen. It can live, thank you. So, it can live only where there is abundance of oxygen. So, if somebody give you something saying it is probiotics or some good for bacteria, if it is not having oxygen, this means he is lying. Right? So, simple. So, there is nothing called probiotics. There is something called probiotics marketing, but no probiotics in reality. Right? It is always prebiotics. So we have to remove this vocabulary from our life, and we have to add prebiotics. What are prebiotics? The prebiotics are the food which the friendly bacteria like to eat, and they are these. Cellulose, which you can find in green leafy vegetable. Amylose, which you can find in the roots, potato and carrots. Pectin, which you can find in the upper coating of the apple. Inulin, which you can find in onion. So these are called prebiotics. These are the food for the friendly bacteria. But I don't want to confuse you. Thank you, friends. Thank you. With these complicated name, I don't want to confuse you. I want to give you only one name, familiar, fiber. Food with fiber, simple. Food with fiber. Fiber is, the other name of fiber is prebiotics, right? When you want to talk technically, when you want to look that you're more intelligent, then you say prebiotics. But in reality, I am just wanting to say it is fiber, right? Fiber. So now, the next slide, the most important slide. Refined food is food minus fiber. What is refined food? You take any food, you remove the fiber, it becomes refined food. So refined food is food for friendly bacteria or resistant bacteria? Simple, right? So food for resistant bacteria and fiber. So what we have been doing in the last 30 years? We are throwing the food of the friendly bacteria out, and the remaining, which is the food for the resistant bacteria, that we are eating. And the result is in front of you. Lot of hypertension, lot of diabetes, lot of cancer, right? So more refined food, less is fiber, less is friendly bacteria, more is resistant bacteria. Very simple formula. So you have to just make it opposite. More of fiber, more of friendly bacteria, less of resistant bacteria. This means less of refined food. Or if you want to put all of them together, it will become like this. The formula for growing friendly bacteria in your body is simple as prebiotics, right? The fancy name, simple name is fibers, plus phytochemicals. Phytochemicals, simple is any compound which is found in fruits and vegetables. But if you want to confuse someone, phytochemical, right? So, nitrosamine. Nitrosamine, if you want to confuse somebody, if you want to appear to be more educated, nitrosamine. But if you don't want, in a simple language, if you want to make people understand, so it is like this. Animal protein or tobacco, it creates a kind of chemical which is called nitrosamine. Phytochemicals are the compounds which are found only in fruits and vegetables, right? So the formula becomes this plus this minus this. If you can do it for a few days, you change your second brain. You change your second brain within few days. So here, prebiotics, which the other name is fiber, we have to understand when you cook the food, when you process the food, unfortunately, the fiber is lost. It loses its ability to work as a food for friendly bacteria. Humans are the only animal who cook the food. Have you seen cat cooking a food? So I'm not saying that you should stop cooking from today. I'm saying that you should eat food also those who are not cooked. You should eat fiber also. That's what I'm saying. In addition to whatever you're eating, minus that last part, plus the fiber, you add to it. I'm not saying you stop your rice, you stop your dal, I'm not saying that. But I'm saying that you're missing something, you add that. And something which is harmful, truly you minus it. If you can do this, it is not difficult, I'm sure, right? And if you can do it, is it difficult? Somebody who is saying it is difficult. If you say difficult, I will remind you of few slides back. I think that is easy. This is easy, right? So the moment your patient will say, sir, it is very difficult, doctor, I cannot do it. Okay, don't worry, I have something for you. One more slide for you, right? So when you think of this or this, that looks so easy. So keep both the side. So you have both the technique to cure a patient, right? Which one he prefer? You keep fruits and vegetable, right? Many patients says, doctor साहब कौन खाएगा, मेरे दांत तो मेरे है ही नहीं, right? नहीं खाने की जरूरत नहीं है, हम डाल देंगे. So it's we can heal a person, no doubt about it. Like curing body is no problem, but who will cure the mind? First, the mindset has to be changed, only then you can change the body, right? Body can be changed within 4 days, 5 days, 10 days, right? But the change starts only when your mind changes. So that is a bigger process, that is a bigger effort, which we have to put.